All right, Marcia. Right there be fine. Well, y'all, thank you again for coming. This is another way we're continuing to try to keep the great people of South Carolina up to date on what is going on with the virus and our response to it. As we've said before, the virus has been, since sometime in March, has been chasing us, but now we're chasing the virus. We are developing and implementing an army of people who will not only be conducting testing all around the state, but also tracking the virus. That is, when someone tests positive, they will be counseled, and those that they came in contact to will be taken down, and they will be contacted as well. And that is what they call the tracking, the tracing of the virus, and that's how we contain it. We know the virus now. We know how it works. We've seen it and we've felt it, and now we're going after it. It's a great statewide effort, and all of this has been in the Accelerate SC meetings that many of you have watched, that you've seen here in this room, with people from around the state with insight into every aspect of South Carolina life, here giving their advice and guidance on things we should do. So we are accelerating. South Carolina, when the virus came, we did not shut down like some other states did, but we did slow down. And so now we're accelerating back up, and we hope to be at full speed just as quickly as possible, but also as safely as possible. So today I'm announcing the lifting of restrictions on close contact services, and also lifting restrictions on recreational and athletic facilities and activities. They will be lifted as of Monday, May the 18th at 12:01 a.m. Monday, May the 18th at 12:01 a.m., 1 week. Now, the guidelines and recommendations on the safety and sanitary practices by Accelerate SC, which are detailed and comprehensive and can be found on the accelerate.sc.gov website, as well as DHEC and the various other websites. They are excellent, and if they are followed, they will provide excellent guidance. So what are the close contact services? Those are these: barbershops, hair salons, waxing salons, nail salons, tattoo and massage parlors, and tanning salons. And what are the recreational and athletic facilities and activities I referred to? Those are the fitness centers, gyms, spas, public and commercial pools, yoga, and other exercise facilities. Also today, the Department of Administration has presented earlier today to the Accelerate SC group a comprehensive reentry plan for state employees. You'll recall that on March the 19th, as the virus was coming in upon us, I issued an order for non-essential employees, that is, those state employees that could be deemed non-essential, that could work elsewhere rather than from the office if necessary, to work at home. And they've been doing that. By April the 3rd, we had 55,484 state employees working at home or on leave. Now, I'd say they were working is what they were doing, and we had about 19,003 that were still coming into their regular offices to work. Well, it's time to turn that around now, but as we went into it gradually with our reductions in limitations on businesses, we're also coming out very methodically and carefully. So the first group of state employees will begin returning to their offices once there is ample personal protective equipment on site, but no later than June the 1st, as they will be coming back in. No later. They can start as soon as the equipment is there, but no later than June the 1st. And the regular limitations, the regular rules and hygiene practices will be incumbent upon them as everyone else: social distancing, the sanitizing, the taking the temperature, and travel restrictions. We'll attempt not to have groups traveling in a vehicle together, not going if not necessary. If they can do it remotely, do it that way. If they must travel, then travel in in small groups, not large groups, and we will gradually return to normal. And Marcia Adams is here, the Director of the Department of Administration, to answer any detailed questions that you have on that. We're glad to have with us again today Josie McDaniel Burkett and Holly May. Ladies, again, we appreciate your help very much. We couldn't do it without you. And now Dr. Bell.
Thank you, Governor. And good afternoon, everyone. As our nation and state continues to respond to COVID-19, DHEC remains committed to protecting the health and safety of all South Carolinians. And we want South Carolinians to know that DHEC is doing everything possible to stop the spread of COVID-19. And a component of that is increasing our testing capacity. As of today, a total of 89,968 tests have been performed in South Carolina, covering approximately 1.7% of our population. Of those tests, 7,792 have been positive, and that's approximately 9% positive over time. To assist in this effort, our federal partners have committed to provide DHEC with enough swabs and testing supplies to test 2% of South Carolinians for May and for June. Our goal is to test 2% of the population, or 110,000 South Carolinians per month, and we're currently on track to meet this target by the end of the month. In order to begin the safe transition back to a less restrictive quality of life and vibrant economy, we recognize the importance of increasing access to testing in communities across the state so that we can detect disease activity and understand how well it is controlled. Widespread testing is important in every community because each of us continues to be at risk for exposure to someone infected with COVID-19. But enhanced testing is especially critical in rural and underserved communities where residents may have limited access to health care, limited transportation, and limited access to the internet as an information resource. Expanded testing will allow free testing for all residents and will help everyone continue to take steps needed to help slow the spread of COVID-19. Increasing testing will help us rapidly identify hotspots and outbreaks before they spread and will indicate where resources are most needed. To increase testing in underserved and rural communities across the state, DHEC is working with our community partners throughout the state to set up free mobile testing and pop-up testing sites and clinics to bring testing to these communities, as well as working with some of the traditional medical homes where people can find ongoing care. We currently have 14 mobile testing clinics scheduled across the state, with more planned in the coming days. We will continue to inform the public of locations of COVID-19 test sampling sites, including multiple and pop-up clinics. With increased testing, there will now be an increase in the number of positive cases reported. And this means we'll need to expand the extent to which we can provide contact tracing for positive cases, and we are prepared to do that. Contact tracing is a disease control measure that is commonly used by public health officials, and during normal operations we have approximately 20 contact tracers who find the contacts of certain infectious diseases, like tuberculosis or hepatitis, for example, to help us limit the spread of those diseases. And DHEC has been conducting contact tracing for COVID-19 since the first report of that infection in South Carolina. As we enhance our testing efforts, DHEC set goals with our Accelerate SC partners to identify 1,000 contact tracers by May the 31st. And I'm pleased to announce that we have met that goal. As of today, we now have 400 contact tracers on staff, and we've retained another 1,400 contact tracers through contracts with 2 private staffing companies. That's the Apple One and C-Trace. And in addition, we've had over 660 members of the public who have expressed an interest in becoming contact tracers through our contact tracing webpage. As people from across the state ask what they can do to help stop the spread of COVID-19, our response is to be socially responsible and community-minded, and to continue to practice social distancing, wearing a mask while out in public, to avoid touching frequently touched items, regularly washing your hands, monitoring for symptoms, and to seek testing if you are ill or if you think you've been in contact with someone who has COVID-19 infection. If you have tested positive or have been exposed to someone who has tested positive, one of our team members will reach out and will make sure that you have the information that you need to help protect yourselves and your community. And for the latest information and updates on COVID-19, please visit our website at scdhec.gov/COVID-19. Thank you.
Thank you, Dr. Bell. It's quite something to have 660 people volunteer to be contact tracers. That says something about our people. So, with that, are there any questions? Yes, ma'am.
Governor, walk us through some of the restrictions or some of the new processes that will be in place in these hair salons, nail salons, gyms. What kind of requirements will be in these facilities?
There'll be the ones that you have heard of before about every other seat will ask to be not used, that they do it by appointment, they not have people in the waiting room, that they clean all the equipment, everyone washes their hands, customers as well as they go in, that the workers there, the people providing those services will wear masks or wear shields and wash their hands and wash the equipment and all of those things that you've heard. But it goes into some detail because all these services are a little bit different. But a lot of thought went into them. They're common themes, and the goal is to be sure that virus can't get to us. And they will all be posted. Ms. Adcox.
Yeah, you said first group of employees must come back by June 1st. How do you define first group? Who are among the people that need to come back?
Ms. Adcox.
Thank you. Yes, ma'am. The first group to come back would be those non-essential employees who it's more difficult to continue their work from home. So they would come back. And this plan is really built for flexibility for agency leadership. Each agency's mission, their staff of employees, they're different. So what we would do is bring those folks back first. And this is in a phased approach. So the employees that can successfully, are successfully and easily right now working from home would continue to do that. This allows time for agencies to make alterations to the workplace, to get needed PPE, and it also allows time for us to consult with health officials like DHEC to make sure that everyone is safe and there's not an outbreak. Then with phase 2, we would bring more of those employees back, and there will be at least 2 weeks in between these phases as we begin to bring employees back.
Can you give me some examples of what's in that first group?
Yes. For example, we may have some folks that do more clerical duties where they have been answering phones remotely. It may not, they have been performing their work, but it may be harder and harder to continue to do that remotely. So we would probably bring that back in. There are also some managers that would need to come back with that group. And also another example would be call center. Some call centers are remote right now, but it may be easier to manage them coming back in the office. And depending upon the mission of that agency, that may be some of the first groups that the directors would like to bring back in. Again, socially distanced, looking at things like staggered shifts. We don't want all of those people in the workplace at one time. And on our plan, if it'll be posted on the website, there's a lot of details that will help agencies manage that process as those employees come back into the workplace. We want to make sure they're safe and that we continue to provide those functions of state government.
In the back. Yes, ma'am.
Dr. Bell, can you go in a little bit more detail on the contact tracing, what that means?
Yes, what contact tracing means, and this is something that we've always done in public health, is that if we get a report of a particular infectious disease, so when we receive reports of COVID-19 cases that have been confirmed, we will notify that individual. We'll make a contact with the person who is confirmed to be ill. We will interview them. We'll provide guidance to them about the measures that they should take to prevent spread, staying in isolation until 10 days after their symptoms have started. But we also interview them to find out who they have been in close contact with. And this means people who have spent a fair amount of time with them face to face, and we ask for those contacts. It's a confidential process, though, and we reach out to the contacts. We won't say who they've been a contact of, but we will talk with the contacts of confirmed cases and then explain to them the measures that they should take, that they should monitor for the presence of symptoms, that they should stay in quarantine for 14 days after their last contact, and that they should seek health care if they develop symptoms, and that they should seek testing if they develop symptoms.
Dr. Bell.
Yes, over here, over here.
Dr. Bell,
The lake behind that one.
Governor,
ma'am.
Governor, when
Yes.
you reopen these close contact businesses, how will you enforce inspections or make sure that these salons, these tanning salons, are following these restrictions?
Well, we are depending on a number of different levels of enforcement. One, of course, would be the business owners, the employees, and the customers that go into these places. I think there are certain expectations of what people are seeking when they frequent one of these establishments, and if they're not there, then the marketplace will work. But we in order to be competitive, you have to be following these guidelines, or you lose all your customers. In addition, there's always a chance of if someone is reckless and does not have the necessary equipment or the necessary procedures, then if someone gets sick, there's always the civil justice system. Someone may bring a lawsuit and blame it on that business or that place. And then, of course, we still have in effect, is the criminal procedure, the criminal prohibition that any group of 3 or more people that are causing a problem in terms of threatening the health, whether it's 3, 23, or 103 people, then they can be cited with a criminal citation. Yes, ma'am.
Governor McMaster, I know that with the reopening that we saw last week and the phased reopening that we're seeing today and moving forward, we're seeing lots of restaurants that do have customers coming in, but we're seeing other restaurants where it's pretty bare. And now that wait staff has been brought in, but they're not able to make tips. What do you say to those waiters and waitresses who now have to go back to work but cannot get unemployment and can't make their money like normal?
Well, this is a pandemic, and there are certain hardships that are inevitable, unfortunately. We have done everything we can to see to it that the unemployment insurance is there. As you know, we have gone from, I can't remember how many callers it was, I think from 29 people answering the telephones up to 500 or 600, as well as had the national computers, the Social Security computers, re-energized so they could handle the volume all around the country, because every unemployment claim from every state must go through the Social Security system, one computer. So we've done everything that we know how to do so far to see that those unemployment benefits and other benefits are there for the employees, for the owners, their disaster loans. I think the amount of money that Director LZ of Department of Employment and Workforce says has flowed through his office is over $1 billion, $1 billion already, and we're still going. So we're working hard to see that these hardships do not happen. Yes, sir.
Governor, you talked a lot about churches, places of worship that have voluntarily asked people not to come in. The Catholic Church is going to go back next week. Are you going to put out any guidelines for how churches should return?
Let me ask, if guidelines suggestions have been promulgated for the, now let me say, churches there's a First Amendment that recognizes the importance of churches. So the legal limitations on churches is something that we have not done and will not do in South Carolina, although we've made recommendations, the same recommendations that apply to everyone else apply there, but those are recommendations. More.
Well, that's correct. Just a few more points. We have had, DHEC staff have had a number of conference calls with church leaders across the state, interdenominational, the faith community. we have also pointed them to information that's provided by the CDC. And so on the CDC website, it provides guidance about social distancing, how to hold religious services, communion, how to manage daycare centers that are in churches. So all of that guidance has been provided, but on a facility by facility basis, different churches have different size congregations, and so we are also talking with them individually when needed about what they can do within their own church.
And of course, we're using the word church. That applies to synagogues, all religious institutions and faiths. Yes, sir, Joe.
Dr. Bell or Dr. Toomey, there seems to be like a spike at the end of the week when cases are announced. We see like 90s a couple of days, and then at the end of the week, you see like a bunch of cases over 200. Is there a reason for this pattern, for this roller coaster of positive case counts happening at the end of the week?
Well, not necessarily at the end of the week, but it's very observant that the curve dips up and down. And if you look at the actual dates of the dips of those curves, they're on weekend days. And so that is a function of the majority of the testing sites are providing testing Monday through Friday. So that when we present data that is based on the date that the test was performed, you see that bump because there are fewer weekend days when tests are being conducted. And if you look at the curve blocked out by weeks, then that is a smoother way and really a more reasonable way to track the data, and it doesn't have those dips and plunges in it.
Is DHEC still reporting the cases on when the positive results get reported to you as opposed to when the swabs are taken?
So we are reporting the dates that the positive results are reporting to us. We're also reporting the dates when we have that available of the onset of illness, and then we're also reporting the date that the test was conducted. So there are 3 different data points there.
Dr. Bell, question for you. There's a report about 6 people who died after going to a funeral in Kershaw County. Now we're seeing some schools plan graduation ceremonies. What kind of restrictions would you like to see in place, or what should people be doing at these large graduation ceremonies?
Well, so I guess I wouldn't call them restrictions, but again, the guidance is the same. When we make recommendations about the size of groups that should convene, it is most important to pay attention to the social distancing, and now we're saying about 10 feet between people, especially if you're going to be convened for a longer period of time. We continue to recommend the use of masks when you're in a public place. For graduation ceremonies, we're also making additional recommendations about ingress and egress to a facility, limiting the number of family members that can be invited. Many schools are planning outdoor activities, are maybe planning rotating ceremonies so that all the graduates in a class won't be there at the same time, and that the families may be spaced out in a stadium or something like that. But it's still all dependent on the gathering of large groups of people, and the principles are the same.
Over there.
Governor, the State House comes back tomorrow. What would you like to see them do when they're back in session tomorrow?
I'd like them to pass the continuing resolution so that the government can continue to function. The continuing resolution has been under consideration since they left. And if I've told them that I'd be perfectly willing, if they can't get it done, that I would be happy to call them back into session for that purpose. But we will not let the government be shut down. I will see to that. In the back, yes, sir.
Governor, how hard is it to make these decisions to reopen businesses? I mean, you have people's lives in your own hands, and obviously we've had almost 350 people who have died from this, and it seems like it's almost the opposite of a hurricane evacuation. Instead of telling people to run away from danger, you're telling people it's okay to leave their houses and maybe take a little bit of risk.
Well, fortunately in South Carolina, we have a lot of very smart people, very experienced and very dedicated to the people of the state, and they're willing to serve on Accelerate SC. They're willing to work in these state agencies and otherwise to give us good advice. Making the decisions is not the hard part generally. Usually it's getting the facts and understanding what the facts are, and then usually the decisions are pretty easy to make once you have the adequate facts. And with the talent that we have available to those of us making decisions from people of all walks of life around the state, it makes it I would say, a good process, a strong process. Yes, ma'am, Sean.
Dr. Bell, actually, we rank among the last in the nation when it comes to testing per capita, and I realize we have a plan going forward to ramp that up, but why have we lagged so far?
Well, there are a number of reasons. One of them had to do with the shortage of supplies, and of course, most states did experience a shortage of supplies, and so we did prioritize our testing for those who were sickest initially to make sure that hospitals and healthcare providers and emergency responders could be tested. And then we progressively made recommendations to providers to expand that testing. But another factor is that in some states that were harder hit than South Carolina with disease morbidity, with disease activity, when they were doing the same prioritized testing process for those who were sicker because they had more sick people, like in New Orleans and New York, well, they were still testing within the same priority groups, but there were far more people in that category. So South Carolina at that time, when we had a shortage of supplies, didn't have as big of an impact of people who were severely ill. That's another reason why we had not tested as widely. And then another factor is that in our some of our under-resourced areas, we did not have the ability to provide services to get testing supplies to providers in rural areas, and that's another reason why we're establishing those pop-up clinics and working with the partners to establish testing sites to address all of those gaps that we previously saw.
Governor,
Yes, sir.
any expectation on when we could expect amusement parks, entertainment venues, concert venues? When do you expect to allow those to reopen?
That will depend on the facts. We're working on that now. And to the previous question, all of us here have got jobs. The people that are having to make the hard decisions are those 400 and something thousand that are not working, that we're trying to get back to work. How do they prioritize? What do they do? Those are the people that we should be thinking of. Yes, ma'am.
Do you have an ideal date in mind where all restrictions will be lifted? Are you guys talking about, by the fall we could see?
The ideal date would have been sometime in March to have them all restricted as being unnecessary. No, ma'am, there is no ideal date, but I can assure you that we are working as hard as we can, gathering information and recommendations and facts and science from all concerned to unleash South Carolina's great potential as soon, as quickly as we can, but as safely as we can. Yes, ma'am.
For the salons and gyms opening, is this a recommendation or is it mandatory? Is it up to the business?
No, these are all, we're just lifting the restrictions. Again, it is up to the business owner, the clientele, the customers, the staff, all concerned to decide whether they are ready. They need to have the personal protective equipment. They need to have signs up. They need to take the steps necessary. They must gauge their clientele. There are a lot of decisions. We're just getting the restriction out of the way to let them make the decision as to whether to go forward and how. Yes, ma'am.
I've heard complaints from the business owners themselves, that they didn't get the guidelines quicker. Could you discuss why guidelines didn't come sooner?
Well, it takes a while to get all the information put together by a group of authoritative and experienced people who can have the right guidelines. The last thing we want to do is have incomplete. This is not something you rush into. We're moving as quickly as we can, but we're not going to make a mistake by rushing. It's the old carpenter's rule: you measure twice and you cut once. So I think our state is doing much better than many others because we took a deliberate, careful approach into what we were restricting. In some states, they actually closed down manufacturing plants. In Detroit, they closed down the motor companies up there, the car companies. In some places, they closed down all the churches. They closed down businesses, large and small, across the board. We didn't do that. It wasn't necessary, and the infection rates and the compliance of our people has shown that we made the right decision. So we're taking a very careful, a very thorough, and a very strong approach. Yes, sir.
Real quick for you and Dr. Bell, you live and work here too. I'm sure you've seen people out and about not following the guidelines you've put in place, specifically masks. What would you say to the people of your state not wearing masks when they go out and about?
I would say that you have to be your own doctor. You have to take care of yourself. those of us in government, in healthcare, and a variety of other things from every source have given recommendations based on science, experience, and best practices. And when it gets to the end, it's up to the individual either to be smart or to be careless. But I would urge everyone to listen to the people who know what they're talking about, and then make your decision, not only for you, but for your family as well, and your neighbors. Yes, ma'am. Final one.
I have one for Dr. Bell. Dr. Bell, with the phase reopenings that we have been seeing, is this something that you, as one of our top state health officials, is this something that you recommend right now?
Well, what we can do for the people who are looking to resume their normal activities is to provide the guidance that's available for them to do that as safely as possible. And so it's really not about recommending what they should and should not do. We want everyone to be aware that we continue to see significant disease transmission in the community. We want everyone to be aware that they're still potentially at risk. So I would add to that, we want everyone to be their own personal physicians and take care of themselves. But we're also asking people to be community-minded. We're really not just taking care of themselves, we're taking care of the community. So if they will follow the recommendations for protection, they are protecting themselves, but they're reducing spread in the community. And the sooner that we can all do that together, then it becomes simpler and simpler to resume normal activities. And we will continue to provide guidance about the safest way to do that. But I just always have to reiterate the importance of social distancing, limiting contact with large groups, wearing a mask, practicing hand hygiene. So no matter what we do, those basic messages remain the same until we see a significant and sustained decrease in disease activity.
Thank you very much.